Men wait for certainty. They want 100% proof before calling for help. But heart attacks don't announce themselves clearly. If you're watching this alone, if you live alone, or if there are hours of your day where no one is around, this video could save your life. Because most heart attacks don't happen in hospitals. They don't happen at the gym. They don't happen with people standing by. They happen at home, alone, often in silence. And the men who survive aren't the strongest. They're the ones who recognize what's happening early and act correctly. Today, I'm going to walk you through exactly what to do if you're alone when a heart attack strikes. What causes it? The early warning signs most men ignore. The symptoms that mean this is real. What to do minute by minute. And how something as simple as aspirin can dramatically improve your chances, and when it absolutely should not be used. Stay with me, because the most dangerous part of a heart attack isn't the pain. It's hesitation. At the end of this video, I'll explain the one mistake men make in the first 5 minutes that turns a survivable heart attack into a fatal one, and how aspirin, yes, a simple, ordinary aspirin pill, could make all the difference. Let's get into it. Why heart attacks kill men at home. Here's the brutal truth. Heart attacks kill more men at home than anywhere else. Not because they're stronger, but because they wait. They wait because they don't want to overreact. They think it's indigestion. They think it'll pass. They don't want to cause a fuss. Or they assume heart attacks look dramatic, clutching the chest, collapsing, sweating, fainting. Real heart attacks are often quiet, confusing, and gradual. And when you're alone, there's no one to say, something's wrong. No, this isn't normal. Call for help. That decision falls on you. So let's make sure you know exactly what's happening inside your body. What actually causes a heart attack? A heart attack happens when blood flow to part of the heart is suddenly blocked, usually by a ruptured plaque inside a coronary artery, followed by a blood clot forming on top of it. That blockage starves heart muscle of oxygen, and heart muscle dies quickly. This isn't a slow process. Damage begins within minutes. The most common underlying causes: long-term inflammation, high blood pressure, high LDL cholesterol, insulin resistance or diabetes, smoking, chronic stress, poor sleep, sedentary lifestyle. But here's what matters. Many men who have heart attacks didn't feel unhealthy the day before, which is why early signals matter so much. Watch out for these early signs most men ignore. Before a full heart attack, many men experience warning signs, sometimes days or weeks earlier. These are subtle, easy to dismiss. Watch carefully. Common early signals: unusual fatigue that doesn't match activity, shortness of breath from minor exertion, chest tightness that comes and goes, pressure or discomfort during stress, sleep disturbances, jaw, neck, shoulder, or upper back discomfort, a vague sense that something feels off. Men often explain these away as aging or poor sleep or stress, heartburn, a pulled muscle. But your body doesn't whisper for no reason. In a moment, I'll explain how to tell the difference between indigestion and a heart attack, even when the pain isn't in your chest. Heart attack symptoms when you're alone. Now let's talk about active heart attack symptoms. These do not always come on suddenly. They can build over minutes or even hours. Classic symptoms: pressure, squeezing, fullness, or pain in the chest. Pain spreading to the left arm, shoulder, neck, jaw, or back. Shortness of breath, cold sweat, nausea or vomiting, lightheadedness or dizziness. But here's what catches men off guard. Some heart attacks don't cause sharp chest pain at all. Instead, you may feel a heavy pressure, a deep ache, a burning sensation, a tight band around the chest, extreme weakness, sudden anxiety, or doom. If something feels wrong and unfamiliar, treat it seriously, because time is heart muscle. The moment you realize this might be a heart attack. This is the most important section of the video. If you suspect a heart attack and you're alone, do this immediately. Step 1. Stop what you're doing. Sit or lie down. Do not try to walk it off. Do not push through. Step 2. Call emergency services. Do not drive yourself. Do not wait. Do not text someone and hope they respond. Emergency services can start treatment immediately, guide you through steps, alert the hospital, save minutes, which save heart muscle, Put the phone on speaker. Stay on the line. Step 3. Unlock your door. If you can do so safely, unlock the door so help can reach you. This matters more than people realize. Mention aspirin pills earlier on. This is where aspirin comes in and why it matters. Aspirin does not stop a heart attack, but it can slow the damage. Here's how it helps. Most heart attacks involve a blood clot. Aspirin inhibits platelet aggregation, makes blood less sticky, and slows clot growth. This can buy time until proper medical treatment. Here's how to take it. How to use aspirin for maximum effect. Use plain, non-coated aspirin. Typical emergency dose is 160 to 325 milligrams. That's one full-strength aspirin tablet as measured in the United States and the UK. Chew it, don't swallow whole. Put it in your mouth and chew it. Chewing speeds absorption. Important note, only take aspirin if emergency services advise it or if you've been told previously by a doctor that it's appropriate for you. Because aspirin is not safe for everyone and can cause severe problems for some men. Who should not use aspirin? Aspirin is powerful, but not for everyone. You should not take aspirin if you're allergic to it. You have active gastrointestinal bleeding. You have a known bleeding disorder. You've been advised against it by your doctor. This is why calling emergency services first is critical. They can guide you safely. And, as a precaution, check with your doctor today to confirm whether aspirin is recommended for you. This is what not to do during a heart attack. Do not lie flat if breathing is difficult. Ignore symptoms and wait. Take random supplements. Drink alcohol. Take someone else's medication. Drive yourself. Try to sleep it off. Every minute you delay increases permanent damage. The biggest mistake men make. Here's the mistake I promised earlier. Men wait for certainty. They want 100% proof before calling for help. But heart attacks don't announce themselves clearly. Emergency doctors would rather see 10 false alarms than miss one real heart attack. If you're wrong, you're embarrassed for a day. If you're right, you're alive. Choose life. Quick pause. Before we continue, as we are talking about men's health and well-being, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Okay, survival is possible, even alone. Surviving a heart attack alone is possible. Men survive every day because they act early. Don't minimize symptoms. Call for help fast. Follow instructions. Use aspirin correctly when appropriate. Preparation isn't fear. It's responsibility. If this video helped you, do things right now. First, save it. You may never need it, but if you do, you'll want it close. Second, keep an aspirin pill or tablet in your pocket. Third, share it with one man you care about, because the man most likely to ignore heart attack symptoms is the man who needs this information the most. Your heart doesn't get a second chance, but you can give yourself one. Now, watch this video for more revealing content on men's health and well-being.